ever. Welcome, everybody. My name is Vikas Sani. I'm president of the Lown Institute. Thank you all for being here as we present the 2024 Bernard Lown Award for Social Responsibility to Dr. Lilia Cervantes. So please feel free to continue with the appetizer course while we say a few things. And as we do that, I want to start by recognizing some special guests. So first, Dr. Altaf Sadi, last year's winner of the Bernard Lown Award. Then Dr. Mark Ernest, who nominated Dr. Cervantes this year. The critical step. Members of the Lown family, who are all here in part to remember and recognize Bernard Lown, who would be 103 tomorrow. And I also want to thank current and past members of the Lown board, if you could just wave your hand at least, for all your service. Thank you. And a very special and very big thank you to the American Medical Association for being our visionary sponsor this year for this year's award. Thank you very much. We're very grateful. And of course, a big thank you to all the other sponsors who are here for making this what is clearly a successful evening. Some of you may have seen the displays outside at the bar and the registration table of the US $1 mint coin. That has a likeness of Dr. Lown. It's part of their series called American Innovation, and it was commissioned by the state of Maine, where Dr. Lown came from in one part of his life, obviously. And if you haven't already seen it, please take a look. It's very interesting. Now, Bernard would have been 103 tomorrow, and for me at least, it's a time for some reminiscence. I can't begin to tell you what an enormous pleasure it was working with him. One of those pleasures was rounding with him at the Brigham. It was, as a young clinician, it was dazzling. It was inspiring to see him in action with patients. Frankly, it was sometimes jaw-dropping, listening to him give marital advice to his heart patients. But he was that familiar with them, their families, their personalities, their history. It was a real lesson in what doctoring is all about. I would be lying if I didn't say it was also really fun in between patients debating him, the merits of Flaubert or Turgenev, Karl Popper or Karl Marx, Gorbachev or Kissinger. He had an amazingly wide-angled lens, and there's no doubt that made him the visionary he was and created the impact that he had. So for those of you who don't know us, the Lown Institute's current work focuses on hospital social responsibility. Our annual hospital index is the first to report metrics like unnecessary care and the first to include metrics of equity, community benefit spending, CEO pay, and racial and class inclusivity of hospitals. Like Dr. Lown, we're developing a reputation for being technically savvy, but telling it like it is. And we're starting to have an impact too. So recently, the head of one of the leading healthcare foundations in the country said to me that he hoped to get his organization to where the Lown Institute already is. He said, we need to catch up to you. Somebody else just yesterday, a well-accomplished lawyer said, you know, your institute is at the cutting edge. You do really high quality work, and it documents the changes that we need, both in practice and in policy. And I should say, policymakers seem to be taking note. We've been invited to brief the Republican majority of the House Ways and Means Committee, the Senate Health and Labor Committee that Bernie Sanders chairs, the Senate Finance Committee, the New York City Council, the California Department of Health Accountability and Information. So you get the idea. We are definitely on a roll. And I think Bernard would be really pleased. But I also have no doubt he would say, you just haven't gone far enough. And to that I'd say, we're gonna stick to it. Happy birthday, Bernard Lown. So now I'd like to call Zachary Lown to say a few words. Zach?
So I'll pick up on something that Vikas said with regards to my grandfather, which was about his expansiveness of vision. And I had never met anybody quite like my grandfather, who had made inroads seemingly in so many different areas, in medicine and politics, relationships. And when he passed, which still feels recent, actually feeling sad this time of year, and hadn't seen this, can't see it because it's behind me, but it's like almost life-size picture of him. But when he passed, it felt like such a massive loss at a precarious time. And we could probably say the same thing today. And as I have sat on this selection committee for the last 3 years now, I've been incredibly impressed and moved and energized actually seeing how many people there are with this kind of expansiveness of vision and the ability to make roads on so many different fronts. So some of you may remember that our first winner was Dr. Mona Atish, who Dr. Atish is a pediatrician who blew the whistle on Flint's lead crisis and withstood ridicule and government pressure, and ultimately forced the governor to acknowledge that children were being poisoned by lead and paved the way for action, for something to be done about it. And Vikas also recognized our winner last year, which was Dr. Alpa Sadi. And Dr. Sadi and her family escaped the Saddam Hussein government, came to the US, and moved by her own experience as a neurologist. She eventually took over leadership at the Mass General Asylum Clinic, helping to lead to a grant of asylum for hundreds of asylum seekers, and she also changing lives in the process, among her other accomplishments. And those were just the winners. So, unfortunately, you all didn't even see our list of candidates, which every year has been very difficult. It's actually been very difficult to be on this selection committee. And Dr. Cervantes actually, as a matter of fact, when the award was first established, was my first choice in 2022, and was then renominated twice more. And in fact, going back to my grandfather's passing, after he had passed away, and I was sort of seeing these other visionaries and people who I see kind of in his tradition, the first thing that I wrote to my family in the aftermath was a summary about Dr. Cervantes as a way of exemplifying the candidates and just some of the other individuals who were out there who had also applied for the award. So I think that Dr. Cervantes embodies some of the principles that my grandfather espoused. One of the things that my grandfather used to like to say was that every time he had a great idea, somebody would chime in and tell him why it wouldn't work, or why it was too expensive, who would oppose it. And he said, forget that. He said, all that matters is the idea. If you agree with the idea, then we'll figure out a way to make it happen. So first the idea, and then action. And there aren't a lot of people who can do that. To start with the idea and then actually have the ability to get it done. So Vikas will talk more about Dr. Cervantes, but Dr. Cervantes saw that her undocumented patients with end-stage kidney disease were refused Medicaid, which forced them to come to the ER on the brink of death every 6 to 8 days to receive emergency dialysis in the ICU. And so she saw the problem, she mobilized, she organized, and ultimately she got the support to pass legislation which enabled for that to be a covered condition, for that type of treatment to be covered. So first the idea and then action. And that reminds me of a final Dr. Lownism, I'll reminisce as well. We would call it a grandpaism, which was, when I was sitting as a kid in his library, which is a small study with floor to ceiling bookshelves, and I'd be sitting on an old leather couch, and he would tell me, with one person, you're nothing. He said, with 2 people, you're moving. With 3 people, you have an army. And that was one of the lessons or spirits that he wanted to impart. So Dr. Cervantes embodies this spirit of seeing harm and mobilizing for action, and the Lown family is really proud and gratified and grateful that you are continuing this tradition. Thank you.
Thank you, Zach. So I think it goes without saying that the Lown Institute is trying to change the narrative. And despite what I'm about to say, we're here tonight to celebrate everything that's right in the world. But most people know that healthcare is in crisis, and the crisis has many dimensions. But I think the current pandemic of clinician burnout shows that it's also becoming a crisis of moral purpose. And the problem isn't the people in healthcare. I think we all know that. We know that America has some of the best in the world, brilliant clinicians, amazing research, cutting-edge technology, and yes, hallowed institutions. The problem is how the system, or as Dr. Michael Fine always reminds me, the non-system is organized and run. But we're not here to list those problems, we're here to celebrate. At the Lown Institute, we have a vision of a radically better healthcare system, one in which everybody has access to the care they need, and not more, free from worry about it, where communities can flourish, health professionals get routine, deep satisfaction from their work, and the nation actually grows stronger. It's a system where everybody's in and nobody's out. And the system we want cannot be transactional. Like Dr. Lown's clinical practice, it has to be based on relationships. 100 years after the Flexner Reform report transformed American medicine, the major shortcoming is no longer a lack of science and technology. The major shortcoming is a lack of social responsibility. So getting to the system that we want requires a paradigm shift. And paradigm shifts require leadership. Leadership of a new kind. That's why at the Lown Institute we created the Bernard Lown Award. And that's why we're here tonight honoring Dr. Cervantes. Dr. Lown was clearly that kind of a leader, the kind that got expelled from Johns Hopkins Medical School for desegregating the blood supply without permission, or who got vilified for partnering with Russian doctors because he saw that nuclear war would mean the end of human civilization. So this award recognizes that kind of a leader, intellectually honest, iconoclastic, uncompromising, and willing to take risks for what's right. So this is the third year of the award, as you heard from Zach, and it's exciting to see it grow. This year we had over 30 nominations, and all of them were really inspiring. I completely second what Zach said. It's really remarkable. There's a lot of important stuff bubbling up out there. So Dr. Cervantes, could you join me up here for a minute? So Dr. Lown once said to me, I think I have a surgical mentality, and that really bothers me. Meaning, whenever he saw a problem, he was impatient to take action. Dr. Lilia Cervantes is cut from the same cloth. Dr. Cervantes was born in Denver and then spent her childhood and adolescence in Ciudad Juarez in Mexico and El Paso, Texas, before moving back to Denver for college. She majored in biology and minored in Greek mythology. So again, this expansive vision. And then she went to med school and residency at the University of Colorado. Despite the major in molecular biology, she told me she never thought she'd be doing that kind of research. When she won the Harold Amos Award from the Robert Wood Johnson Foundation, she told me, I genuinely thought they'd made a mistake in admitting me. And the reason? She felt like an outsider, someone who didn't have any of the publications or notable research experience and didn't think that the world of arcane methodologies was the be-all and end-all of good research. Or to put it another way, in the system as it's currently configured, she felt out of place. But actually, to my mind, she was exactly in place, exactly where she needed to be. Her place, the penumbra between the inside and the outside of our current models of care, that's where novel solutions are going to emerge. And living in that gray zone forces all of us to ask ourselves, what does good research look like in a time of upheaval like ours? So one key idea fundamental to Dr. Cervantes' thinking is the notion of community-supported research. It's a concept that's very relevant to our own work at the Lown Institute as we seek to nudge hospitals to spend their community benefit dollars guided by local needs and local community agendas. And when paradigms are shifting, that's when outsiders bring new ideas and new energy into the mainstream. And God knows we need leaders like that today. Does anybody here really think that 100 years from now, anyone is going to remember or care about leaders who moved a few pieces around the board, administering the status quo, or even worse, just enriching themselves? I don't think so. Another of the pleasures I had in working with Dr. Lown was in his joy as a clinician. After a busy day at the office, he would turn to me, and I was probably very bleary-eyed after being up all night with someone with intractable sustained ventricular tachycardia, and he would say, "Wasn't that a marvelous clinic? Doctoring feels like dendritic contact. It's like an electrical connection with the patient." He was always so energized by his patients, and he talked like a novelist about the life stories he was hearing, and always the human connection. Dr. Cervantes will tell you the story of her patient and friend, Hilda Cortez, who died from kidney failure. To me, in her last moments, it was obvious that this was an incandescent moment of human connection. And it's clear that it energized Lily for years. she recognized she absolutely had to, she was just compelled to change the system. She embraced research and advocacy for dialysis for the undocumented, and she led the state of Colorado to change their policies. Within a few years, 5 other states have followed. Dr. Cervantes has a growing national profile as her efforts have rippled across the country, and she's not stopping there. She now has a big NIH grant for kidney disease and structural racism, and plans to do her research in full partnership with local communities. That's exactly what we need. New norms and new models for a new kind of healthcare system. So I don't know how long she'll be working on that grant. I don't know that she won't be appointed to a job by her governor. I don't know that she won't run for office. What I do know is there's no doubt you'll be hearing a lot more from her in the years to come. Lilia Cervantes is leading by example and is part of an emerging vanguard of young clinicians, some of whom are here tonight with us, who together are shaping a new paradigm of what healthcare should be and could be if we have the courage to go after it. So now it is my great pleasure to present the 2024 Bernard Lown Award for Social Responsibility to Dr. Lilia Cervantes.
Thank you. I want to thank Mark Ernest, Chief of the Division of General Internal Medicine at the University of Colorado, for nominating me, for being a mentor, a sponsor, a coach, and a friend. I want to thank my family, David and Sophie and Bella, for being constant pillars and for encouraging me to pursue healthcare policy change. This award that bears Dr. Lown's name is deeply meaningful. Dr. Bernard Lown is a role model for every physician who tries to speak and act on societal issues that impact health. He was not a bystander. He took action and said, "How can I be a doctor?" and close my eyes to this overwhelming reality. The American Medical Association Code of Medical Ethics shares the spirit of Dr. Lown's words, stating in some cases the law mandates conduct that is ethically unacceptable. When physicians believe a law violates ethical values or is unjust, they should work to change the law. I began my medical career as a hospital medicine physician at the Safety Net Hospital in Colorado. I took care of undocumented immigrants with kidney failure who had no access to regular 3 times per week dialysis. Instead, they would come in on an emergency basis once a week to be dialyzed. Of those patients, Hilda became a very dear friend, and knowing her changed the path of my career. Our lives were parallel. They were parallel except in one critical way. We both grew up in poverty. We both grew up with English as our second language. We were both young and we both had small children. The only difference between Hilda and I was our immigration status. My parents moved to the US just 1 week before I was born, so I was a US citizen. Hilda was undocumented, and that made all the difference. Without regular access to dialysis, Hilda was admitted to the hospital when she was on the brink of death, weekly. Her boys had to call an ambulance when they witnessed her heart stop several times. They witnessed emergency staff do chest compressions trying to keep her alive. And each week, they wondered if their mom would be alive to the following week. Sorry. After years, Hilda made a very difficult decision. She decided to find adoptive parents for her boys so that they wouldn't live in constant psychosocial distress. And she stopped emergency dialysis. 10 years ago, Hilda died on Mother's Day. After Hilda died, I could not continue to provide this type of unjust, ethically unacceptable, and morally distressing care for the other undocumented immigrants with kidney failure at our health system. Hilda illustrates how one patient can change a life. She started me on a path of advocacy at the state level. I connected with nonprofits, the governor's office, and legislators. This advocacy to provide undocumented immigrants with standard dialysis was complicated. People did not want this highlighted because it was politically polarizing and had financial implications. But I kept going. I read everything possible about this type of care, and I found enormous gaps in the literature. I decided to learn to conduct research for the sole purpose of changing policy. The Harold Amos Medical Faculty Development Program from the Robert Wood Johnson Foundation provided me my very first funding opportunity. For 5 years, I led research that highlighted the issue of emergency dialysis, using qualitative research methods to understand the perspectives of patients, their caregivers, and their clinicians. We also did quantitative studies and looked at mortality and symptom burden and quality of life. In the qualitative research, one clinician said, "Emergency dialysis makes us feel very inhuman. We're torturing them." Another physician said, "It's a strong message about how we see patients. Some are worthy and some are not." To echo Dr. Lown, my team and I couldn't close our eyes to this overwhelming reality. Together with nonprofit organizations and in collaboration with patients, clinicians, and health systems, we engaged in very strategic advocacy, and we successfully expanded access to regular dialysis in Colorado through Medicaid effective February 2019. Our work did not stop. After we changed this in Colorado, we continued to publish on this, getting the message out to research, clinical, and policy audiences. We disseminated our research in many ways, through perspective narratives that described the blueprint, social media, podcasts, letters to state Medicaid directors, and mainstream media. We strengthened and forged new collaborations with several state Medicaid directors, and to this point, an additional 6 states have expanded access to standard dialysis for this community. And I'm excited to share that now over 20 states provide regular dialysis to undocumented across the country. Today, I'm honored to be celebrating this award with future social justice leaders who are mentees in this work, many of whom are here in attendance. I believe mentorship is a critical component of social justice work because we know so much more health justice work needs to be completed. We need to build a coalition of leaders that will remain steadfast in anticipation of what's to come. And so to begin, if you can raise your hand, one such voice is Katie Rizzolo. A nephrologist who trained in Colorado and is now here at Boston Medical Center. Katie expanded access to home dialysis for undocumented immigrants in Colorado, and she's published extensively on access to kidney care disparities in undocumented immigrants. There's also Haley Simpson, an oncologist, and Apurva Ram, an internal medicine physician in Colorado. And They both wanted to improve access to cancer treatment for undocumented immigrants. Over the last 4 years, the three of us conducted research, wrote policy briefs, letters of support, met with the governor's office numerous times and legislators. And I'm excited to share that in January of 2024, so just a few months ago, we successfully convinced our state to expand access to chronic conditions for all undocumented immigrants. Another voice is Matt Sinclair, a nephrologist from Duke, who's working on culturally responsive interventions to slow the progression of kidney disease to kidney failure. There's also Trish Santos, and she just joined Emory and Grady, and she's working to build all the evidence necessary to change access to cancer treatment care for undocumented immigrants at the federal level. There's many more mentees that couldn't be here today. I want to return to the quote of physicians in moral distress. Some are worthy and some are not. As clinicians, moral injury is not something we can stand by and abide. It is a wake-up call. It should compel us to act and inspire us to create change. The privilege we have of caring for people comes with the duty to take concrete action when we witness suffering. We see what many of our friends and neighbors will never see. We see the social and structural barriers that shorten lives and cause suffering. After Hilda died, I faced a choice. I chose to act. I didn't know I could make a difference, but I believed that I had to try and that I had to keep trying. It came close to costing me my career, but engaging in advocacy has allowed us to do things I didn't think were possible, and to build relationships that we've cultivated and have propagated so much more health and social justice change in our state. I want to end by saying that it is critical that we urge our administration and members of Congress to include all U.S. residents, regardless of immigration status, in plans for a universal healthcare system. We must have a more just and equitable health system that can respond rapidly and effectively, and not just to threats that are well known like climate change and emerging diseases, but also respond to threats that have long been swept under the rug, institutionalized threats like inadequate access to dialysis and cancer have existed and have been tolerated for much too long. Though we continue to work on this on a state-by-state basis, the ultimate change needs to be at the federal level. We cannot and should not idly accept unjust and unsustainable systems or merely stand by while undocumented immigrants are left out and excluded from healthcare, left to rely on a patchwork system. It's time to defy the status quo. It's time to confront, to demand, and to create change. I believe that Dr. Lown and all of you here believe this and work for this goal. Thank you.